All right, this is week 4, full body assessment. So you would start your assessment just by checking general appearance, looking to see if they actually look their stated age. How old are you?
26.
She's definitely looking like that, maybe even a little younger, so you're looking good. Level of consciousness, obviously she's alert and oriented. You know the date?
9/11.
Do you know where you're at?
Diary Ridge Medical Center.
All right, and then you would also look at skin, you would look at nutrition. When they were coming in, you'd check their posture, their mobility, facial expressions, mood and affect, speech, hearing, and hygiene. And then you would do your measurements, weight and height, body mass. You would check your vision with the Snellen chart if you needed to. And then you would move on to the assessment. So you would start with like the skin. Everything basically is compared to the skin on your hands and all of that. So it's warm, it's appropriate for race. Then scalp in the head, everything looks good. Hair, no gray hairs yet, that's a plus.
I have gray hairs.
I don't see any gray hairs, so we're good. But everything looks good there, not dry or anything like that. And then we would check cranial nerve 7. So smile for me and frown. That's okay. Lift your eyebrows and show your teeth. And puff your cheeks out. And what you're looking for with that is when you push and get the air to release, that it releases equally on both sides of the cheek. Then we check the TMJ. So open and close your mouth. There's a little bit of a click on that right side. So you can feel that one. And then sinuses down in through here, any pain or any pressure that you're feeling in your sinuses at all?
Not today.
And then for the eye exam, you would check more of the cranial nerves. You would also check any of the external eye structures and the pupil light accommodation. You would darken the room as in previous video assessments where you're examining the eye with the ophthalmoscope. I had to think of the word for it for a second. And I'm going to save your eyes and not shine the bright lights in there just because I know your eyes were really sensitive the last time we did it, but we've already got that on. So that would be the next part of the assessment. Then you would go for the ears. You would want to check alignment and make sure that they're symmetrical. You would want to make sure they're in the right position. They're not too high, not too low. Any pain on the tragus when I palpate that? So everything's good there. And then you would use the otoscope, as we've done before, and look at the tympanic membrane and make sure that everything is good there. And then we check our hearing. So if I whisper, can you hear me? Okay, so she can hear me whisper, so hearing is good. So with the nose, you want to check for some symmetry, make sure that it's equal, it doesn't go off to one side. You want to check and make sure that everything, you can breathe out of both sides the same. And then you would use the otoscope again with the light and kind of examine and make sure everything looks good there in the nose. Mouth and throat, you check your teeth, so smile for me. Okay, and then you check the, so stick your tongue out for me. And it's pink and nice and no, okay, and say ah, and stick your tongue out. And you visualize the uvula, make sure that it's midline, not swollen, anything, everything looks good there. And then you go on to the neck. You want to check for any lumps. You want to make sure that it's symmetrical. You want to check for the nodes. It feels good there. And then you also want to feel for the carotid pulse. There. I don't know how to find those, right? And then you just want to make sure with the neck range of motion. So if you take your and go to the other side, you want to make sure that there's no stiffness or anything there. Go back and forward, drop it to your chest. Okay, and then look to the right and the left. Just making sure everything's even and midline. Then you would go to the posterior part of the chest, and you would take the gown and kind of expose the back, and you would check the muscles and the ribs and make sure everything is symmetrical there. And from there, then I will do this part. I'll auscultate your breath sounds, so if you can lean up for me here. Breathe in. Then from there, you would move to the interior chest. You want to check to make sure that when they're breathing, that they're not using any accessory muscles, that they're not retracting anything. And then you would want to check for any tenderness up and along the collarbones and upper ribs, any tenderness when I'm palpating there. And then you just auscultate the upper lungs. Good air movement on both sides there. And then from that point, you're going to check for any murmurs or anything like that. So you have the patient lean forward so that you can kind of put some pressure, bring the heart forward in the chest a little bit. And I don't hear anything there. Then you check the upper extremities. And with that, you're checking range of motion and strength. So just first of all, we'll start here. Just shrug your shoulders. I'll try to push down. And you push them up. Okay? Equal there. Put your palms like this. Try to pull up as I push down away from you. Good there. And we're going to fly away. And squeeze my hands. And everything's equal there. Range of motion wise, you can move your wrists back and forth, elbows full, and shoulders. No pain or anything with that.
Mm-mm.
All right. Then from there, you would check all of the neck vessels and everything. If anything would call for it, you could listen for the carotid. And you can hear all of that. And then from there, you would check the heart. You're going to listen for the rate and rhythm. You're going to look for any pulsations that you might see. And you're going to listen to various parts of the heart. It'll be nice and not go. You listen to the very bottom as well. For the abdominal, we have not done an abdominal assessment yet, so this will be the first one of putting that together. So some of the questions for the abdominal assessment that you would ask are, have there been any changes in your appetite? Any changes in weight? Obviously you're pregnant, so that's going to change. We know that. Any difficulty swallowing? Any food intolerances? Anything that upsets your stomach more? Okay. Any abdominal pain or nausea and vomiting? Outside of the norm of being pregnant, but I think you're past that point. How often do you have bowel movements?
About once a day.
And any changes in those habits? That's what it's always been.
Yeah.
Okay. Any diarrhea or constipation? Any ulcers or hernias ever?
Mm-mm.
Any operations?
C-section.
C-section? Okay. And then have you ever had to have any like x-rays, abdominal CTs or anything like that? And are you on any medications or anything for that? Anything that might cause your stools to be different? Some patients that are on iron, obviously their stool can get black and tarry, which is a sign of a GI bleed for us. So you need to make sure you know if they're on iron or not. And then also Obviously, for patients on blood thinners and you start seeing blood in the stools, that can be a concern as well. So you just want to watch for that. And any alcohol.